Hello everyone, welcome to InnoHEALTH Conference 2024. I'm Deepshikha, your host for the InnoHEALTH Magazine podcast. And today I have here with me Dr. Tanu Jindal. Ma'am, if you would just give us the pleasure of familiarizing the listeners with who you are and what you do.
Okay, thank you. I am Professor Tanu Jindal. I am working on environmental health, toxicology, safety and management. And basically we are working with the climate change and what are its impact on health and why climate change has happened and how we can mitigate its impacts and how we can adapt through it so that we can save from its menace, we can save the planet, we can also save the existence of human life.
Well, that's great to know, ma'am. It's a pleasure to have you here with us. So you talked a lot about, and you're very enthusiastic about owning up to being prepared and being aware of the changes that one needs to take as a citizen, as a healthcare expert, as a public health expert, as a clinician, and so on. So what are some strategies that you think healthcare enthusiasts stepping into the healthcare arena need to be aware of, or the unknown trends and patterns that we need to be aware of so we can mitigate as maybe future policy experts, as maybe future educators and so on?
Okay, so healthcare experts need to know about the possible resurgence of any disease outbreak which is happening because of the climate change, and the main culprits of climate change are heat stress and also waterborne diseases, then air pollution, and these three are the main culprits. But then they also have their babies out of it. So healthcare professionals need to be aware about the possible cures or preventive measures which public can follow for it. And then there are certain vaccines also available now in the market which are protecting us from many diseases in advance. And they also need to work on the immunity part of the people, how they can build on the immunity by consuming certain kinds of foods, which like vitamin C and other things, plus the basic hygiene which people should follow, and they own the place, ownership, by awareness program. Ownership among the people can be inculcated so that they remain healthy, they also make their planet clean, and they become socially responsible citizen.
Well, thank you, ma'am, so much. So you were a part of this session called Climate Change and the Unknowns in the healthcare scenario, right?
Yes.
And then we have the conference's whole theme, which is based on AI in healthcare. Do you see the education of students and healthcare experts in the making, and then the unknown patterns that are coming us and hitting us as a wave, and how people can be prepared for it? From an educational perspective and from people who are going to step as well, how can we prepare and what strategies are something which you're seeing experts bring into?
Okay, like you said about AI is very important. In COVID also we could face it because we had data available globally as well as at national levels. So there were certain parts of the country which were having outbreaks, so certain parts could be saved, they were cut by the policy makers and the movement was restricted. It's like a chain was cut, so it is protected from further spreading. Similarly, AI data like tsunami warning systems are there. We have very good tsunami warning systems, so people can be, the place can be vacated and they can be displaced at a safer place and shelter. Then AI can be used for delivering medicines, consultation of those medicines, and food packets are given but people don't know what to take. Then AI also is used for trauma relief and other things. Then AI also can be used for keeping people know about what are the current technologies which are available, not only for healthcare but for other sustainable practices which they can follow, so that they minimize the waste and thus minimize the emissions and minimize the global warming and climate change. So it's a kind of circle one has to complete, and that's why we focused on not working in silos but bringing all the stakeholders together, be it public, be it policy makers, or be it scientists or researchers, so that we can face this stage of climate change, global warming and impact on health in a smarter manner and this planet is also intact, and globally, globe has become a village. It's not no longer, it's like we all are working together, and we get to know about the news if something is breaking out in some other sector, and some new discoveries are there, new medicines are there, that also can be, like in India, we are the first one to produce COVID vaccine at the half the cost. And now we are supplier of 40% of the global population. Secondly, every second person in the world is having vaccine made in India. So all these things, they not only improve economy, but it will also bring equity in a manner, and by involving all the gender into it. At the same time, you're making it eco-friendly. So these three components, economy, equity, and ecosystem, these three things we can take care by integrating AI and being aware and bringing all the stakeholders.
Thank you, ma'am. So, well, we know that we have many unknowns coming for the AI sector in healthcare. We have many unknown trends and patterns emerging in the whole Indian healthcare scenario as well. But when we have experts like you and educators like you in the whole healthcare ecosystem, what's there to fear about? Thank you so much, ma'am. Thank you for your inputs. I hope the listeners benefit a lot from it.
Yeah, welcome.
Thank you for your time.